So, Duncan, you're here representing NCD Child from Kenya. What sort of take-home messages, or how does this meeting, do you think, going to affect you when you go back, and the work of NCD Child as well?
Okay, it has just been so clear on the role of climate, not only how it affects the environment, the socio-economic, but also importantly the health. And it affects the poor much more. And if we can focus on the most affected, who are the poor people, those individuals, the families, the communities, I think that would be a big way to ensure that climate change does not really adversely affect the health of our people.
So you think so you're a doctor who works in a hospital. How do you see the link between this big population, high-level stuff, and your sort of day-to-day work and the drivers for your day-to-day work?
Okay, it's really a complex association between really climate change and the health issues that we really see. But the reality is that climate does affect the health of our people, and whether it's through direct associations or indirect associations like poverty, I think there's a big association. Like, for example, I'm working on rheumatic heart disease, and that is caused by poverty, which could have been associated with some climate change, leading to strep throat, etc.
What do you think, though, sometimes with the global climate change challenges, that the countries who really were not part of the cause of it are now expected to change their behaviour to have a global benefit? Do you think that that's sometimes unfair and unreasonable to expect people in Kenya who are already struggling to have to change and struggle further?
Yes, definitely it's so unfair, so that someone who did not really bring these issues leading to climate change is the person most adversely affected. But we have to face it. We will not have to wait for the government, for other organizations to do it. I think from the individual, from the family member, from every member of the community, I think we just have to take responsibility no matter what cost it, and solve the issue.
So when you talk to the Ministry of Health people in Kenya, do they think they understand and appreciate the important interconnectedness of all of these issues, and that they really need to talk to people in agriculture and education and environment? Is that a difficult conversation to get them to have?
I think it has been a difficult conversation, especially in having systems thinking, wholesome thinking of how these issues are interrelated. And it's my wish that every ministry, every part of the government can really focus on this, whether it's Minister of Education, Minister of Health, Minister of Energy, like all of them work together towards ensuring that we combat this problem.
Great. Thanks very much for talking to us.
Okay, thank you so much. Yes.